Good afternoon. Today, Lieutenant Governor Polito, HED Secretary Mike Keneally, and I will be talking about important funding to support small businesses here in the Commonwealth. But first, I'm going to provide a quick update on the state's COVID numbers. Yesterday, the Department of Public Health reported 4,162 new cases. There were 90,789 tests done and reported, and we now have done over 10 million tests here in the Commonwealth. 1,919 individuals are being treated in the hospital for COVID, and 387 of those folks are in the ICU. We'll obviously continue to closely monitor this data, including new cases and hospitalizations, as we head into the brunt of what I might call the holiday season. As a result of the Thanksgiving surge in cases and the huge number of people ending up testing positive and in the hospital, our healthcare system is under immense pressure these days, and this certainly threatens, in some respects, our system's ability to continue to care for everybody who needs help. This obviously is a huge concern. It's critical that we make sure that our healthcare system can provide the life-saving care to both COVID-19 patients and to non-COVID-19 patients who are in need of urgent medical assistance. The upticks in cases and hospitalizations that started after Thanksgiving has slowed slightly, but not enough by any means, especially with the Christmas and New Year's holidays coming up, where we unfortunately anticipate there could be another significant surge. If this second holiday season produces a surge in infections that we saw that's similar to the one that came out of Thanksgiving, we'll be in serious danger of overwhelming our healthcare system. As we discuss this and model it, every option is on the table, and we're currently reviewing additional steps that we can take to try to minimize the impact of all this. But the tools that we have available at our disposal won't stop the virus alone. We continue to need everyone, and I mean everyone, to think really hard about the consequences of the actions that they take throughout the rest of this holiday season. And let me just be as clear as I can be about this. In some respects, we're basically begging everyone to stay within their immediate household over the course of this holiday season. We're not asking people to do this forever. We're asking them to do it for the next 10 or 12 days. We can have the kind of celebrations we want to have around Christmas and New Year's next year. But we simply can't afford to have another spike, one of the largest in the United States, take place after the Christmas holiday while we're still dealing with the spike that came from Thanksgiving. We'll have more to talk about on this soon. And while we're certainly doing all we can to fight the virus and keep our economy humming, there's no question that we are obviously in need of support from our colleagues in Washington. Many of us spent a good part of the weekend tracking and following the back and forth and the conversations that were taking place in D.C., and it's gratifying and a bit of a relief that Congress is currently in the process of finalizing a deal for another COVID relief package. We anticipate this will include funding for an extension of unemployment assistance, which for many people would have run out on 12/31 of this year, and a variety of other COVID-related resources around testing, vaccinations, and tracing, rental assistance funds, small business supports, and a series of other critically important initiatives to support people, not just here in Massachusetts, but around the country. And obviously, we're hoping and anticipating that Congress will swiftly approve this and get it done and get it to the President so that he can sign it. After months of uncertainty and challenging circumstances, this support is a welcome present for so many people here in Massachusetts and around the country who need it to help build the bridge between here and the successful implementation of a widespread, safe, and effective vaccine. This has obviously also been a very challenging year for other sectors of our economy, and small business owners, perhaps more than anyone else, have gone through unimaginable disruption, loss, and uncertainty. Despite that, they've done everything in their power to keep their staff and their customers as safe as they possibly can, and to commit to the state's very aggressive safety protocols. But even the most creative businesses, especially small ones, need support, especially those in gateway cities and in many of our neighborhoods of color. In October, we announced a $774 million comprehensive economic recovery plan with a $50.8 million small business grant program to be administered by the Massachusetts Growth Capital Corporation. These grants prioritize business owners who are businesses owned by underrepresented entrepreneurs and those that did not or were unable to access the federal Paycheck Protection Program or other federal or state aid. Through partnerships with business groups and community organizations, including the Black Economic Council of Massachusetts, Amplify Latinx, the Massachusetts Association of Community Development Corporations, the statewide Coalition for an Equitable Economy, Local Support Initiatives Corporation, and the Foundation of Business Equity's Business Equity Initiative, a significant portion of the applications, 37% in the applicant pool, were from minority-owned businesses. Our administration, through the MGCC, has spent weeks reviewing applications to ensure that funding reached the highest need small businesses. Today, we're pleased to announce that we're distributing grants to 1,158 Massachusetts small businesses. Recipients will be notified later today that their applications have been accepted and approved. 100% of the recipients are minority-owned, women-owned, veteran-owned, LGBTQ-owned, or owned by individuals with disabilities. Lieutenant Governor Polito and Secretary Keneally will get into more detail in a few minutes. We do want to point out, however, that there were an exceptionally large number of applicants, more than 10,000 all in, who were seeking over $500 million in relief. The funds for the first round clearly didn't cover the ground associated with those who applied. But I am pleased to announce that the Mass Growth Capital Corporation did receive an additional $17.5 million in small business relief from this year's budget that we just signed, and that budget also contains $9 million for small business technical assistance and grants. The MGCC will go back to the existing pool of applicants soon to select recipients for a second round. And this chunk of money is obviously a good start, but our administration's original budget proposal to the legislature included significantly more. That's why last week we filed a supplemental budget that contains another $50 million in additional funding for small businesses, including $17.5 million for this particular grant program. And obviously, the list of businesses that need our help keep growing. While we understand the budget process was immensely challenging this year, we believe we can afford this additional funding, and we hope the legislature will act soon on this assistance. Even with the additional funding that I just mentioned, we know the need far exceeds these resources, and that's why we hope to see the Economic Recovery Bill, which we also filed earlier this year, which contains an additional $275 million in authorizations, including $50 million more in small business assistance, will be enacted by the legislature soon. It's an excellent package, and it can make a real difference for a lot of people who at this point in time really need it. And before I pass this off to the Lieutenant Governor, I do want to mention that we have a short update on the Transportation and Climate Initiative that we've been working with our colleagues across many other states on for the past year or so. Well, COVID-19 has obviously dominated our agenda day to day. We haven't taken our eyes off this other urgent challenge that the Commonwealth, the country, and the world is facing, which has to do with climate change. Across the nation and here in Massachusetts, we're already seeing the impacts from climate change, like increasingly severe storms, more frequent droughts, floods, and across the South, a hurricane season unlike any other. I believe that we as a Commonwealth have an obligation to address this challenge, which is why earlier this year we committed Massachusetts to achieving net zero emissions by 2050. And today Massachusetts is joining Connecticut Governor Ned Lamont, Rhode Island Governor Gina Raimondo, and Washington, D.C. Mayor Muriel Bowser in launching a Transportation and Climate Initiative program. This bipartisan approach will reduce transportation sector pollution by at least 25%, and we should all remember at this point transportation is the single biggest generator of carbon emissions in the carbon emission generating pool, and will generate over $1 billion for Massachusetts by 2032 that can be invested in cleaner, more equitable, and more affordable transportation options. Together, the states of Massachusetts, Connecticut, and Rhode Island account for about 73% of transportation initiatives in New England, a pretty good place to start. The close connection among our economies and transportation systems will also ensure that this program creates employment opportunities and economic growth for the Commonwealth as well as the Southern New England region. Under the MOU that we signed today, the program is slated to begin in 2023 after a reporting year to allow for additional jurisdictions to sign on. And while we're the first states to commit to this program, we'll work with the other states that are involved with the Transportation Climate Initiative, including for the first time the state of North Carolina, on the further development of this program. And as part of this initiative, Delaware, Maryland, New Jersey, North Carolina, Pennsylvania, Vermont, and Virginia, who have participated actively in working with us to develop the program, will have an opportunity to implement it at some later date. And we expect and look forward to seeing additional states join in implementing this program as we go forward. This is clearly an important agreement, and it will ultimately strengthen our economy, improve our public health, and allow us to build the resilient, clean transportation system of the future that we all believe we need. And with that, I will turn it over to Lieutenant Governor Polito.
Thank you, Governor Baker. Our small businesses have had a challenging, tough, complicated, and hard year. But through it all, they have demonstrated resilience and patience. For small business owners, operators, and workers, for all that you've done over the course of this year, we say thank you. Through the grants that we are announcing today, some of the hardest hit businesses and communities across Massachusetts will be able to cover a number of expenses, including payroll and benefit costs, mortgage interest, rent, and utilities. As the Governor said, we made a concerted effort throughout the process to ensure that these limited resources would be going to those who need it most. I want to thank the many partner organizations that we worked with to ensure that the application got into the hands of the populations and communities that these programs were designed to serve. I would also like to thank our partners in the legislature for their making this funding possible, and we look forward to continuing to work together to provide additional supports for small businesses in our Commonwealth's economy. Of the 1,158 small businesses that will be receiving these critical funds, 100% are minority-owned, women-owned, veteran-owned, LGBTQ-owned, and disability-owned, including 94% minority-owned and 76% women-owned. More than one-third of award recipients operate in our gateway cities, communities that have been hit extremely hard, not just economically, but by the virus itself. There is more funding in the pipeline for those who have applied to this program, but did not receive a grant in this first round. And we look forward to continuing to work with the legislature on additional resources. Before I turn the podium over to Secretary Keneally, I want to mention that there's another way that our administration is committed to helping our local economic recovery efforts and small businesses in our communities. Mass Development's Commonwealth Places COVID-19 response round, called Resurgent Places program, is an important tool for helping community partners build economic momentum in their own community. This would be in the downtowns and main streets where a lot of these businesses are, and how the communities can use these funds to figure out who needs the support and how to build that momentum as we turn into the new year. The Governor and I were pleased to join Mass Development and local officials at Mills City Barbecue and Brew in Lowell this summer. It seems like a long time ago that we were there with the business owner and awarding not only her business but others in the first round of this program, which was about $224,965 in funding 21 placemaking projects across Massachusetts. Seems like a relatively small amount, but every single one of these is placemaking and helping to place down the seeds for economic growth in the next year. Today, we're doubling down on this program by announcing the availability of $390,000 in funding for a new round. Not only do these projects bring customers to downtowns and main streets that have been severely impacted by the pandemic, but they help build a foundation for cities and towns to meet longer-term economic development goals and help engage community members by getting them involved in planning and recovery efforts. It is good to be talking about those things, but more than talk, putting the resources behind it will really make a difference. Interested organizations can visit massdevelopment.com/Commonwealth Places to learn more and apply. I'd now like to turn it over to Secretary Keneally.
Thank you, Governor and Lieutenant Governor. We're so pleased to be able to notify more than 1,100 Massachusetts small businesses that they will be getting needed support to help them cover expenses, support their workers, keep their doors open, or finally, help them reopen. As we said before, those who are already at a disadvantage before the pandemic have suffered disproportionately as a result of this crisis. Accordingly, today's awards are going to business owners that have faced higher barriers to accessing help from previous programs. You've heard this already today, but it bears repeating. All grants are going to the populations that the program targeted. And out of more than 10,000 applications submitted, 100% of those filed by companies that are minority-owned, veteran-owned, LGBTQ-owned, or owned by people with disabilities that have received no other financial aid during the pandemic will be getting funding. That was our goal when we announced this program, and we're glad that we got there. In my office, we're acutely aware of the sectors that have been hardest hit, and we are proud that we can direct this relief to help them out. Out of today's grantees, 262 personal care providers, 217 restaurants, and nearly 100 retailers will receive awards. That's close to 600 small businesses that support their workers' families, and their communities. And as we look to award the additional $17.5 million in the recently signed budget, we will continue to prioritize the businesses and communities that have been impacted the most. For small businesses that have already applied to the program and were not awarded a grant in round one, your application will be automatically eligible for future rounds. The support for small businesses is just one part of our comprehensive economic recovery strategy. For example, last month we announced $68 million for economic development and housing infrastructure projects. Last week, MassDOT announced nearly $1.7 million in the latest round of their Shared Streets and Spaces program. Soon we'll be announcing millions of dollars in grants for nonprofit cultural facilities that have faced significant challenges this year. And we'll also soon be announcing grants in support of internet connectivity, something that is absolutely critical to people seeking to rejoin the workforce. As always, we appreciate the support from the legislature in this important work. And I also want to thank Larry Andrews and the team at Mass Growth Capital Corporation for their doing an incredible job on this, their incredible hard work, and for being such great partners with us throughout the pandemic in support of small businesses. The economic and public health challenges related to COVID-19 are still very much with us, and we will continue to face them together. Thank you.
Questions?
Governor, you said you're reviewing steps to minimize the impact of a potential post-Christmas surge. Can you tell us what those steps would be, and would they be coming before Christmas in order to prevent a post-Christmas surge, as you said?
Yeah, I mean, I think the most important point I can make here is what we all choose to do as individuals will have as big an impact on this as anything that we can do as a Commonwealth. And the Thanksgiving surge, the post-Thanksgiving surge, was as good an example of that as anything I've seen. I mean, to basically see our positive case numbers double roughly 7 to 10 days after Thanksgiving, a time in which we had all talked about the fact that the kind of gatherings that typically take place over that holiday would be viewed by many as an opportunity for COVID to dramatically expand its presence here in Massachusetts, is exactly what happened. So point number one, I would hope we can all learn from the experience of Thanksgiving and try to be as cautious and as careful as we possibly can across this second holiday season. And if you're going to spend time with people outside your immediate household, you really should wear a mask, maintain distance, and don't share food and drink. Keep the windows open. I mean, follow the guidance that we've talked about before. Now, with respect to what else we might be able to do, we're certainly discussing that, and we'll probably have more to say about it later this week.
Would it
The flight numbers, I don't know if you've been monitoring TSA, saying that they've had 1 million for the last 3 days nationally, and then I talked to TSA today, and they said 30,000 more across all the New England airports. Can you travel safely at all? I mean, I know that the messaging is what it is, but can people get from point A to point B still be safe?
Well, we've said for quite a while now that if you're traveling into Massachusetts, there are guidance, and there are rules associated with that. And those rules, for the most part, people have been pretty good about complying with, but they involve getting a negative test 72 hours either before or after you get here, and quarantining if you don't. And there have been lots of examples, even when we've done spot checks, of people who literally whip out their phone and show us their test result right in front of us to make clear that they in fact did get a negative test. But the safest thing people can do during this season is not spend time indoors for a long period of time around a table without a mask on with people that they don't normally spend every day with. That is the simplest and safest way for people to manage through this.
Any concern about the numbers, though? Any concern about those numbers you're seeing? I know that you talked to us about Thanksgiving numbers. They seem like they were going down.
The Thanksgiving numbers generally associated with travel were way below where they are in a typical year. That was not a bad thing. That was a good thing when it comes to COVID. Obviously a difficult thing for people generally with respect to getting together with loved ones. But the impact of that holiday was obvious. I mean, it was obvious. We had seen a flattening out of our cases for several days, and they literally 7 to 8 days after Thanksgiving, they doubled, and they stayed there. And they have just started to bend down a little bit as sort of a post-immediate surge circumstance. And I think our big worry is that Christmas and New Year's and the week in between have the potential to create the same kind of dynamic we saw over Thanksgiving.
Governor, back in May when businesses started reopening, the state started reopening, you would see outside many stores an employee counting people going in, counting people going out. I don't see that anymore. I was in a big box liquor store yesterday. You would swear it was the Sunday before Christmas. The place was packed. Are businesses doing enough to help stop the spread, as you're asking? And if not, what can be done to make sure that they do?
Well, we've currently, we've had the ABCC, the Alcoholic Beverages Control Commission, working almost full-time on compliance and inspections associated with all the issues associated with the rules and the guidance that we put in place with regard to COVID. But certainly, there's an expectation on our part that businesses would understand that there are rules that they are expected to comply with, and that those rules matter with respect to the way they operate their premises. No masks, guidance with respect to capacity, and those other issues. And I guess what I would say is that, generally speaking, we try to stay in touch with our local boards of health. We talk to them almost every week about what they're seeing and hearing, and where we might be able to support them. I can't speak, obviously, to the specific instance you're talking about, Steve, but my answer overall would be that it's incumbent on businesses to follow the rules the same way we're asking everybody else to follow the rules.
Governor, with regard to hospital beds, do you anticipate opening additional new hospitals in the near future?
I think right now our plan is to continue to sort of gradually open the DCU site out in Worcester, and to open a second facility in the Merrimack Valley up by, in conjunction with Lowell General and UMass Lowell. We've also had conversations with some of the folks in the South Coast about possibly doing something in that region as well. But those are really for all intents and purposes, the 3 sites we're primarily focused on at this time.
Governor, on the small business grants, what can you say to those businesses who won't make the cut this time around, in part because they're working with restrictions that your administration put in place? What's your advice?
Well, the first thing I'd say is that we are going back again to sort of reopen the round based on some of the money we got from the legislature in the budget that we signed, and we did file another $50 million supplemental for small business assistance. So point number 1, I would urge people to contact their state rep or their state senator and ask them to move on that legislation, and to also move on the economic recovery bill, which is currently before a conference committee and has been pending in the legislature since the spring. The clock is ticking on the end of the session with respect to that, but it's also the clock is also ticking for businesses here in the Commonwealth that would benefit from those resources if we could get them across to our desks, sign them, and put them to work. I also think there are resources. I don't know exactly how they're going to play out because we haven't seen the written document yet, but the overarching support for small business in the stimulus plan that's currently being debated and voted on today is $325 billion at the federal level, which obviously will be programmatically distributed to states. But I can tell you this, that whatever resources land in Massachusetts, we'll work as quickly as we possibly can to turn them around and move them out the door. Because we get the fact that those folks are in trouble.
Do you know how many applicants you got and how many were accepted, what percentage you're able to give money to?
My understanding is, I don't know how many applicants. You may know the answer to that one, Mike. But the question, I think maybe the asks from those that would have qualified was somewhere in about the 300 million range. Is that about right?
We got 10,677 applications. Sorry, 10,667. We're funded 1,158. So about 10% of the demand got funded this time around.
Do I have the right number on how many actually would have met the criteria?
It's probably a little higher than that. We had north of 500 total, and I'd say probably between 300 and 400 would have met the criteria.
So there's a gap there.
Yeah.
Governor, over the weekend, the CDC revised their guidelines for giving out the vaccine and said that people over the age of 75 should be among the first group. Are you considering maybe altering the phases that you proposed?
So we just got the actual guidelines themselves. I know they've been reported on, and obviously we'll take a good look at them. The CDC advice on lots of things ends up being incorporated into decisions we make. But sometimes we go in a slightly different direction than they do. And we literally just got them. So we'll be taking a look at them.
The governor in New York is asking airlines with people coming from the UK to provide a negative COVID test. British Airways has agreed to do that for flights coming into JFK. Have you given any thought to that? And how concerned are you about this new strain that might be 70% more transmissible?
So the folks at the airport have been asking to both the FAA and the CDC to get guidance from them with respect to what they believe the right thing to do is with respect to the news coming out of the UK. And we're hoping and anticipating we'll get an answer on that shortly.
And any answer on the vaccine, the Pfizer shipments, as far as where those extra doses went?
Yeah, I mean, look, General Perna, who we've dealt with a lot over the course of the last 10 months, basically said on Saturday, I think, that the difference in what was actually going to get delivered and what was originally anticipated was quote unquote on him, all right? Now we have weekly calls with the White House, and I'm sure we'll learn more on this week's call with respect to what actually happened there. But Perna's a very straight shooter and a pretty honest guy, and if he says that, if he says the issue with respect to why we're getting 35,000 fewer doses between now and the end of the calendar year than we thought we were going to get based on the original Pfizer distribution model, I'm willing to believe him. I mean, I don't have any reason not to. It does mean instead of having 300,000 vaccines to distribute between Moderna and Pfizer by the end of the year, we're only going to end up with 265,000. I think that, as I said before, I'm frustrated about that. But if Perna says this is an issue on him and that it's not a major change with respect to the anticipated distribution of this stuff going forward, unless I hear otherwise, I'm going to buy that.
Governor, we're hearing about some frontline healthcare workers who still haven't been able to get the vaccine. Are you hearing those reports, and do you know why that's happening?
Well, my understanding is at this point in time, somewhere around 21,000 people have gotten the first dose of the vaccine, and that additional doses between Pfizer and Moderna are going to be arriving practically every day. I think over 100,000 Moderna vaccine doses, first doses, are arriving sometime in the next day or two and are being distributed to about 240 different healthcare sites around the Commonwealth for those shots. I mean, obviously, we'd love to see everybody get it all at once, but as we said before, it will take a little bit of a while to ramp up the distribution piece, and every time we get a new shipment, we'll make sure it's deployed appropriately to the audience for which it's intended, which, starting out of the gate, is very much the healthcare worker community. And as I said last week, we had some concerns that healthcare workers would be concerned about getting the shot, and the good news is the folks who are dealing with COVID generally every day have overwhelmingly signed up for it and want it. And my, if you were to say to me, what's on my wish list with respect to this going forward, is that there are no more bumps in the initial rollout for the first dose, but that the second dose for all those people who got the first dose gets to us in such a time so that we can actually deliver it in the 21 or 28 days that are prescribed for dose number 2, so that those folks will be fully vaccinated by the time we get to something like the end of January, beginning middle of February.
Governor, are you disappointed you couldn't get more states to sign on to TCI?
Well, I think the most important thing about this is that 73% of the transportation emissions here in New England, Connecticut, Rhode Island, and Massachusetts are going to move forward at this point in time with the idea that the program would begin in earnest in 2023. And we still have another 10 states plus or minus, including the addition of North Carolina, who are going to continue to work with us on this going forward. I do believe that RGGI, which got off to a very rocky start, the Regional Greenhouse Gas Initiative, which has now been in place for 7 or 8 years, which is a very similar model on power, has turned out over time to be a very effective way to make it possible for people to invest in cleaner energy solutions, resiliency, and energy efficiency. solutions, and it's my hope that over the course of the next couple of years, you'll see additional people come aboard. But you got to start somewhere. And one of the points I want to make about this is the price of doing nothing is very big. If you think about the amount of money that the federal government, state government, and local governments spend these days on weather events, far more significant weather events than anything anybody used to see on a very regular basis. I mean, they had the most brutal hurricane season they've ever had through the South this year. The droughts in California and the high winds translated into fires, and an overhang associated with fires that you could see across most of the American West. We have many instances here in Massachusetts and around the rest of New England where flash storms will flood out whole parts of some of our downtowns for days and sometimes weeks at a time, where people then have to make the investments to clean up the mess, but don't actually get to the point where they make the investment that would make that area resilient so that it wouldn't happen the next time it occurs. And I think one of the things I've tried to impress on people about this from the beginning is this is about two things. One, it's about reducing our carbon emissions to deal with the fact that transportation is the #1 driver of carbon emissions across the country. The second is that the more we can do this on a regional basis, the more likely it is to have a significant impact. And third, the resources that are generated as a result of using a cap and invest program like this can be used to invest in transportation assets so that we aren't constantly fixing them and paying for the price of fixing them when they break because of these significant weather events. We have thousands of culverts in Massachusetts which are constantly being overrun by weather events. And when they're overrun, roads close, intersections shut down, and in some cases you can't even get to some parts of Massachusetts when you get into central and western Mass. We need to fix these things, repair them, and not just repair them, but prepare them for the fact that they are going to be dealing with much more aggressive and significant storms going forward than they dealt with when they were originally designed, which in many cases was 30, 40, and 50 years ago.
Do you think a lot of other governors might have been too preoccupied with COVID to really give this the attention that you would like them to have?
Look, I think COVID generally has been, to use a climate analogy, it's like the hurricane that never leaves. And I think for a lot of states, it's not just affected the way they think about an issue like this in the context of other priorities, but I would argue it's also, it's had a big impact on, a lot of the modeling around transportation. Part of the reason we put off the actual implementation of this thing for a year was because we got to do a lot of work to make sure we understand sort of what the world is going to look like with respect to transportation going forward, so that we get this right when we go through the process of actually implementing it, which at this point in time is a really hard thing to predict.
Governor, the legislature being clear last week that they are going to send you back the ROAC budget provisions on abortion. Do you intend to sign that when it gets back to your desk?
So we have a rule that we don't comment on legislation that's pending because in many cases it ends up looking a lot different when it ultimately gets to us. We'll certainly deal with it when it gets to us. But as I said, when we sent it back amended, we're big believers in a lot of the work that we've done with our colleagues in the legislature on women's reproductive rights for the past 5 years. But we thought the House got a lot closer to getting this right than the Senate, and the final version was a lot more toward the Senate.
Governor, just a clarification on the vaccine. If somebody had their first dose, is their second dose already in the state? And is there any more information about whether you could cross-brand the first dose from Pfizer, second dose from Moderna?
You know what? I'm going to get back to you on the answer. My understanding is we really want to keep people on the same product, and that's why the registry is developed in the first place, to determine whether you got, a vaccine that was a Pfizer vaccine or a Moderna vaccine or ultimately maybe a J&J vaccine. But as as many folks who know a lot more about this than me have said, you know, because of the attention that's been applied to this particular development process, people actually know the brand associated with the vaccine. But if you were to ask anybody, you know, what a flu vaccine looks like, or a measles, or sort of any other, people would not know. The only reason this is really part of the conversation is because these companies and the work that they've been doing has been so high profile. But I do believe the end game here is to try to make sure that if your first dose is a Pfizer dose, that your second dose is a Pfizer dose, and the same goes with Moderna.
Governor,
Is there a dose already here, though? Like if you took the first dose, is there a second dose waiting for you?
No, but it's on the carousel, or whatever you want to call it, to get here when it'll meet the needs for people who are coming next.
Governor, there were more than 500 people in line at a testing site in Everett.
Say
this
again?
morning. More than 500 people were apparently waiting in line at a testing site in Everett this morning. Is the state considering doing any ramp up of testing capacity, or even tapping into the testing they did at colleges with all the students gone? Just didn't know if they're trying to address that ahead of the holiday testing.
So we had, first of all, we're doing more testing now than we were doing 2 weeks ago. We'll be doing more testing 2 weeks from now than we were doing today. There were a series of initiatives associated with expanding our testing program that we announced right after Thanksgiving, right? Some of it doesn't come online until the end of the year. One of the benefits of the stimulus plan that was just passed, not just passed, that is currently being discussed and will hopefully be passed in Washington, is it does make additional resources available to states to continue to expand our testing capacity, and we'll put those resources to work pretty quickly once we get them. Thanks, everybody.